Welcome back to the Business of Wellness. Today on the podcast, we are diving into one of the most talked about intersections of healthcare and food policy, and that is food as medicine. My guest today is the CEO of Mom's Meals, Choi. They are a leading provider of medically tailored, home-delivered meals designed by registered dietitians and chefs to support health and recovery. So whether you've heard about Mom's Meals in the context of the food as medicine movement, or more recently as the subject of major controversy around what we define as ultra-processed, just check out some of the media coverage on that. This conversation goes deep into what it actually takes to deliver on the promise of better nutrition for those who need it most. I was blown away by this conversation with Chris. I absolutely love talking to him. I think what Mom's Meals is doing right now is just so incredibly inspiring. We talk about everything from the nuanced conversation around what processing actually means, what it means to provide meals for individuals around the country. I mean, literally in all 50 states that are nutritious, but also are tailored to a person's individual needs and lifestyle. And by the way, Chris and his team at Mom's Meals, they are reaching people in the most rural of places where people can't even get their own FedEx packages to the most urban of city centers. So he's really doing something incredible, and he's operationalized something really special in the nutrition and medical nutrition therapy space. So I am thrilled to bring you this interview with Chris. Enjoy the episode. And as always, you can find me on Instagram at Jaclyn London RD, and feel free to leave a 5-star rating and a review, of course, wherever you're listening to this podcast right now. Can't wait to hear what you think. Choi, welcome to the Business of Wellness. Thank you so much for being here.
Thanks so much for having me, Jackie. Really enjoy your podcast.
I love that. It's such a pleasure to have you. I feel like we have so many things to talk about, so we're just going to dive right in.
Terrific.
So let's start from the top. Tell us about Mom's Meals for our listeners who aren't familiar. Can you give us a little bit of an overview about what Mom's Meals actually is and the mission behind it?
Absolutely. Yeah. So Mom's Meals, we're a national provider of food as medicine programs. The cornerstone of what we do really is our fully prepared, medically tailored meals that we deliver to the homes of hundreds of thousands of people across the country. And that's really paired with nutritional counseling and other nutrition support and resources to really give people the access they need to good nutrition to live healthier lives.
How did the company start, and where did it start? And give us a little bit of that backstory.
Yeah, it's a great just American family business story. So it was started in 1999 by the Anderson family based in Iowa. Mom's Meals really was born out of kind of the family's desire to provide just good, nutritious meals for loved ones. And they began serving some of the most vulnerable populations in Iowa, the elderly, the disabled, people who are homebound and couldn't cook for themselves. Mom's Meals services really helped to keep them independent in their homes. And it really just grew by word of mouth and expanded eventually to a national company. So today we're delivering close to 1.5 million meals every single week and serving people really of all ages and types, folks that are homebound, folks with chronic diseases, people looking to prevent chronic diseases, even populations like maternal health as well as behavioral health. So it's really expanded, and it's been exciting to see the momentum behind just nutrition and food as medicine and where we're going next.
All right, so let's get into that. So when we hear food as medicine, I think there's a lot of different interpretations of that. I have personally been critical of the phrase only because I think sometimes it's used incorrectly, right?
Yep.
I think it's sometimes a misused term in that there are people who are using it to say that you can cure anything and everything with food. And I think that you and I are probably on the same page about what it actually means, which is food can be preventative medicine, and it can also be something that is an adjuvant therapy with other things that you may need for a specific condition. Where do you stand on this, and where does Mom's Meals actually stand on this?
Absolutely. I think the way you framed it is perfect. And so for us, food as medicine, I think first really is the recognition of the critical link between the food that we eat and our health and wellness. And so as we think about food as medicine, it's really a continuum of nutrition support, resources, education, and access, again, to connect people, given their specific conditions, to connect to the nutrition they need to live healthier lives. And a lot of what the work that we're doing and so many others are doing is how do we not just put that burden on individuals and consumers, but how do we weave that into the fabric of our healthcare system so that we're treating nutrition just like we are hospital visits or doctor visits and prescriptions, and really trying to move from kind of this paradigm of sick care to one that's truly preventive care.
I love to hear that. Can you tell me a little bit more about that? Where do you see that going right now, and how do you see Mom's Meals' role in that?
Yeah, I think we're just starting. So Mom's Meals has been, championing the idea around food as medicine for 26 years, but it's, we're finally starting to see, I think first the recognition of that importance of food as part of maintaining health. It's interesting today. So there's been recent studies. I think the Rockefeller Foundation did a study, and something like 9 out of 10 individuals would much rather manage their health condition through healthier food than they would prescription medications. 4 out of 5 individuals really believe the healthcare system should cover more nutrition as part of keeping us healthy. So we talk about this all the time. In a pretty divided world today, food as medicine seems to be one of those topics that everyone really agrees on and gets. I think with that said, I think something that probably isn't talked about enough is the barriers that people face to actually accessing the nutrition they need have never been higher. Right. So it's everything from the cost of food, and we all see it is, it's skyrocketed. More and more people are food insecure and can't afford, healthy foods. There's location issues. We've got, tens of millions of people across the country that essentially live in food deserts and don't have easy access to healthy produce in grocery stores. And then you have, even things like physical limitations, right? Where we've got, 70 million people who are disabled and a growing elderly population. Right. And so it's hard for them to prepare, healthy meals on their own. And so, I think it's important for us to start with kind of the people where they are and how do we overcome those barriers to really get them the access they need.
Tell me a little bit more about the process for signing up for Mom's Meals. What goes into that? What kind of information do you need from someone to be able to provide them with specific types of meals that you showcase that you can actually provide?
Yeah, absolutely. And so most of what we do is integrated into healthcare systems and payers. Mm-hmm. And so typically we're getting referred to a member who's under the care of a case manager within a health insurance plan, state Medicaid, Medicare, and they've been assessed as needing some level of nutrition support, either because they're unable to cook for themselves, or they've got some significant diet-related chronic conditions that they're managing, or they've just, been discharged from the hospital. And so we're getting that intake, and then we're reaching out to that individual, kind of doing the full assessment of their situation, their taste preferences, what allergens they might have, where they're located, and then very quickly, getting out essentially an order of healthy meals that are tailored to their condition, as soon as possible. And then that kind of starts sort of the rest of the program, which may include, nutritional counseling. It eventually may include some produce in pantry boxes and things like that.
I really think that's so special, especially because there are programs like this. But what is so unique is that to do it through the payer is particularly special. And to also be able to do it in a way where you're being referred rather than having the burden of the individual come to you is also something so unique.
Yeah, I think it's a great model, and we're starting to see more and more of that coverage and adoption by payers and health insurance companies because they see the value of providing nutrition support to, some of their most high-risk, chronically ill populations. We do have a private pay business as well, and so we don't advertise it much, but we have a lot of people who see our refrigerated trucks driving by and are like, that sounds really interesting, and so they can sign up either for themselves or for a loved one and just pay out of pocket.
Tell me where, you mentioned millions across the country, but forgive me, where exactly can one access Mom's Meals? I've always been so curious about this. I have to go on a small tangent just on my own curiosity, but how do you do this at scale? Like, how does an operation like this exist at scale? Is this commissaries across the country where you have par-cooked meals that then get cooked on site? Like, how is this executed exactly?
It's a great question. And it's been, I'd say it's kind of 26 years in the making and a lot of trial and error and just figuring out the right model. So we deliver to any doorstep all across the country, regardless of location. And a lot of our clients really are in some of the most rural, remote areas, even that, a FedEx or a UPS won't deliver to. So it kind of starts with we source ingredients from all over the country. We have 3 large USDA certified kitchens where we produce and package the meals. And then we have a delivery team of 400 plus drivers all across the country, 70 different cold storage locations to ensure that we can quickly, efficiently, and very reliably get meals out to literally any doorstep in the country.
Can you tell me a little bit more about what's meant by medically tailored meals? I know a lot of my listeners are fellow dietitians dietitian, so a lot of us are familiar with medical nutrition therapy and therefore what that would mean for specific types of meals designed for specific conditions. What does that look like at Mom's Meals, and what would you say is the most commonly ordered or needed meal?
We have 9 different menus. We've got a general wellness menu if it's not condition specific, that has the broadest selection of 60 meals that people can choose from, and it's breakfast, lunch, or dinner depending on their preferences. But then over time we developed really focused on some of the most prevalent chronic conditions. So we've got a diabetic friendly menu, a heart friendly menu, low sodium, renal friendly, some of the most common cases that we were coming up against. And those menus all of our meals are designed by professional chefs, but very much in partnership with registered dietitians. And our medical condition menus are developed in accordance with guidance from the American Heart Association for our heart-friendly meals, the American Diabetes Association. And so really taking best practice from a nutritional guidance standpoint and making sure that's getting incorporated into our menus.
How do you balance the science and the nutrition science behind these meals with the other things that are so important about food? Especially, I'm just thinking about from my own hospital days, the renal meal would be just so completely bland, right? And so many of these meals often are, because you're really trying to balance so many different things. And I feel like what makes Mom's Meal so unique and why I was so excited to talk to you is because it's just so incredibly difficult to be able to, let's just say you have all the resources in the world and you actually are in incredibly good shape for someone with, let's say, chronic kidney disease. You still have to do mental gymnastics almost to figure out how to put those meals together, especially if you're trying to cook for yourself. Yes, you're already making a great choice if you're cooking for yourself in the first place. So I don't want to knock anyone who is already doing that. But the taste profile and the comfort of eating food with loved ones, how do you think about the culinary aspect and balancing that with the nutrition science aspect at Mom's Meals?
It's such an important area, and it's why the work that our dietitians do together with the chefs in that partnership is so critical for us. And we've realized this over time, is it can't be just one. Like, we can create the healthiest meal in the world, and if it doesn't taste good and it doesn't appeal to people, food is so personal, right? And behavior change is so difficult that clients need to want to, enjoy that meal, need a big selection of meals, especially if they're on the program for a long time where they have that variety and choice. And so for us, there's, really like 4 core pillars that kind of go into every meal that we design. And I feel like our R&D team, they have the hardest job in the world, because it's not just a great tasting meal, but they need to do all of these things well. And it is that taste and variety and appeal to our clients. And so they're constantly doing research around what do our clients like, what do they don't, how are our populations changing, and are there more cultural specific meals that we need to develop? So that taste is critical. There's the nutritional aspect, which you know well, which is making sure that every meal is nutritionally balanced. It's using, good ingredients, and it's also tailored for these specific health conditions so that it's, really helping to improve health outcomes. But then there's also the accessibility piece, right? Which is, how do we make these meals, as convenient, especially for individuals that aren't able to prepare meals for themselves, so they can put it in the refrigerator, heat it up in a couple of minutes, and really reduce that barrier. And then as part of access, it's also to be able to reach the people in the most remote locations. How do we get them a refrigerated, good tasting meal, but ensure that it stays fresh, doesn't spoil, and stays extremely food safe, right? Because a lot of our clients that are struggling with chronic disease, many have compromised immune systems. And so that's probably paramount for us, is making sure that, we're minimizing the risk of any foodborne illness, right? So that piece is critical. And then the last piece is cost, right? Like, we could, again, develop an amazing meal. If it's going to cost $20, that's out of the reach of a lot of, the people most in need of the service. And for the healthcare system, we're seeing headlines all the time around budget cuts, right? And unsustainable cost. It has to be affordable for the healthcare system to really scale this efficiently.
Let's dive in on that a little bit more. How have you navigated that with cost? Even on an individual level, so many of us are going to be listening to you and thinking, it's hard for me to even figure out where to shop for food that I normally would get at a different price, but now just seems so astronomical. And I have a daughter, and I feel like I'm still ordering something from Instacart almost every day.
Totally.
And it's only going to get worse, right? How do you actually balance that cost, and what are some of the steps that you need to take to make sure that you're getting some of the most nutritious food at the lowest possible price for your customers?
We're in the same boat, Jack. My kids order DoorDash, and it's they seem unable to order, a simple snack for under $20, and so
Right.
it's getting crazy.
Right.
So I think that's been a lot of really the focus of the company throughout our history is, so a lot of our meals, it kind of depends on the state and the condition, but a lot of our meals we're making available for under, $8, $9, fully delivered to the home, regardless of location. And what that takes is just a lot of efficiency, right? And so it takes, a lot of really advanced equipment. It takes great teams that we have who are so dedicated to our clients and the mission and just do great work from producing the meals to fulfilling to the delivery side of things. I think having that kind of vertically integrated model, which the Anderson family started at the very beginning, is so innovative from production to fulfillment to logistics. We've got a large call center that's a 400-person customer care team that's in constant communication with our clients. Having all those pieces integrated together, woven through with technology and increasing levels of automation, eventually AI, just so we can invest everything we have into the quality of the meals, the service, and the care, and try to reduce all of the other costs with getting that meal to the client.
How exactly do you address some of the more diverse needs of different populations that go beyond the medical nutrition therapy component? So I'm thinking how you differentiate between a rural customer who's in the most remote area versus someone who is in an urban city center. How do you address those different needs, those different barriers that each individual might be facing?
We've got an amazing logistics operation and team, and literally daily they're kind of figuring that out. So we're getting orders in all the time, and they are using technology to really route as efficiently as possible. How we can get that specific meal that Mrs. Jones ordered to her as quickly as possible, most efficiently and reliably. And so we use, our team of drivers. We also use some third-party carriers so that we can really optimize, that delivery timeliness and efficiency and reliability kind of all at once. And then trying to understand how the tastes and the preferences of individuals, if they're in, rural Midwest America versus some of the urban centers, tends to vary quite a bit. And so trying to capture that feedback to really inform how do we need to develop new meals that really appeal to both of those segments.
It's different menus, right? So you have different menus for different regions?
Not necessarily different regions. It's, by health condition. Some states do have their own specific menu.
Okay.
Yeah, but we tend to have, like a similar general wellness menu, across the country.
Wow. I know that you've cited some really significant reductions in hospitalizations, in ER visits, and also, of course, healthcare costs. And I know that you've even seen that in some pretty short pilot windows, which is amazing. I'd love to hear more from you on this. What do you think it actually will take to move from pilot results to more permanent policy change and ultimately brand implementation?
This is one of the most exciting areas of the food as medicine movement. Is it doesn't just feel like kind of the right thing to do, but it's the tangible improvements in health outcomes and cost of care. That's where the most exciting piece is. And so we probably 80, peer-reviewed papers, pilot programs, commercial programs. And it's interesting because it's growing across different use cases, right? So we have some of what we do is individuals that have been recently discharged from the hospital. We see from data that there's a really high chance, especially for the elderly and chronically ill, there's a high chance that they end up back in that hospital in 30 days. Like it's astonishing. And it's a terrible experience for that patient. It's super costly for the healthcare system. We did a study with Kaiser recently for some of their heart failure patients. And we found even just, 4 weeks of meals immediately after discharge, tailored to their heart condition, we were able to reduce readmissions rates, 30 or 40%. Versus the control group, and even reduced morbidity rates, within that population, just from that intervention. And then you move to, some of the growing chronic care areas. We've got some wonderful studies with partners in, the diabetes area, in, renal dialysis patients, showing that, 3 to 6 months of medically tailored meals, paired with nutritional counseling on the diabetes side, in a lot of cases has reduced hemoglobin A1C levels by 18-20%. It reduces hospitalizations and ER visits pretty substantially, by 40, sometimes 50%, and then tends to reduce cost of care by 20%. And so again, it's kind of a better experience for that client. You're setting them up on a better path, and you're also taking costs out of the system.
I lost my dad to heart failure, and I think this might be one of the most difficult populations for whom to treat. And yet it's so critical that they have that strict adherence to a low sodium diet. And I can't tell you how many people are trying to say things like, salt is great for you. Have more salt. People aren't getting enough salt when we know that statistically this isn't right. And then there are so many different diseases, heart failure, chronic kidney disease, and even diabetes that really require that low sodium restriction. But the implementation is downright impossible. And I use my dad as the example because my dad had like 100 different higher education degrees. I mean, it might be a small exaggeration, but we're talking about someone who really knew his stuff. But when it comes to actually putting something into place, I think even the smartest people don't realize how incredibly difficult that is. And it becomes really frustrating because even when you have a great grasp of so many other things, or you're highly educated, or you're really intelligent, or whatever else it is, when it comes to actually putting meals on the table for yourself, even if it's just for yourself, it's incredibly difficult. So bridging that barrier between what a dietitian tells you in the hospital, there was always this feeling when I would give a one sheet or leave a patient with nutrition education that there's just no way this is going to happen, right? It's not, and it's not the patient's fault. It's just not easy. It's not possible. So this is just so long overdue in that way.
I think what you described is so representative, right, of so many different families and cases out there. And it's also the reason that your profession, the registered dietitian, plays such a critical role, right, in that education, in the design of, the appropriate diet or menus or meals. And that may just be for an individual with, let's say, heart failure, but more and more we're seeing individuals with multiple comorbidities, right? And kind of, if you've got early stage kidney disease and diabetes, and hypertension, it becomes overwhelming. Like, how do you actually prepare a meal that, hits the trifecta? So, and it's one of the reasons that, you kind of started with food as medicine. What does that entail? I think we believe medically tailored meals is an important part of that. It's not the entire answer. One of the reasons we found meals to be so important is because of what we're talking about is that behavior change, even like kind of where do I start with a meal is so hard. And so to the extent we can make it really easy and appealing for people to get fully prepared meals, they start to eat that, they enjoy it. The lights start to turn on in terms of actually seeing improvements in their health conditions and energy levels and A1C levels. I think that it's a really important catalyst to starting that behavior change. And then if you can coach and educate and guide those individuals to the resources they need, whether it's the right set of groceries or meal planning, for individuals, kind of directing them back to resources in the community, that's a great glide path to more sustained, change.
There's also this huge misconception that for it to be good for you, it has to taste terrible. So I think that just having the medically tailored meals readily available means you automatically have taken one step out of things, right? Because you don't have to think about what you're going to eat at your next meal. But also, once you start eating in a certain way and you get accustomed to these different flavors, you're also way more open to the idea that actually nutritious meals don't taste terrible and that there are ways that you can put them together. So I think the design of that by way of Mom's Meals, where you start with this meal plan and then you ultimately have access to other elements, so powerful.
I totally agree.
All right, so we have to switch gears. We have to talk about your recent controversy. I was telling Chris before we started recording that I am of the faith that in most cases in today's world, even inflammatory headlines are generally positive. I think especially because right now we live in such an attention economy. I feel extra privileged to be able to talk to Chris today. And I really mean that, Chris, because I am a sucker for being able to clarify misinformation at any and all points. So let's get into it, because I feel like I have other questions for you that are quite a bit less controversial, but are related to this controversy, which is how cool is it that you have the Secretary of Health of the United States come and visit your facility? There's a lot of criticism for RFK Jr., some of which is absolutely warranted, and I have been some of the first to be out there being critical. I also feel like he deserves a lot of praise for a lot of the issues that he's raising and a lot of the questions that he has about our current food system and some of the pressure that he's put on the food industry, which I think is also really impactful and super. So I definitely am someone who sees both sides of this. And my listeners are not strangers to that. I've done a number of episodes on the entire MAHA movement. If anyone is new to this episode, you should definitely go and check those out. But he has been publicly critical of ultra-processed foods. So let's walk through the experience first, because that's the juicy part. I want to know. Let's just start with the first step of finding out, how did this happen and what did you do first?
I will say it was a pretty exciting but just surreal experience.
Right.
And so we received a call. I think the secretary and the Department of HHS had heard about some of the work that we're doing. It also coincided with in the state of Oklahoma, where we have our one of our biggest facilities, the governor Stitt there just announced a food as medicine movement, which is super
Wow.
exciting, and it's getting access to nutritious foods for some of their highest risk populations. And so as RFK was doing a visit to Oklahoma to celebrate that, um, they called us and said we'd love to do a visit and just kind of learn what you guys are doing and really showcase the work. So, first there's a little bit of panic, like, oh my
Right.
God, we've had a lot of visitors through a lot of healthcare, but never at this level. And kind of the time leading up to it was just different. Like we had federal marshals, on site,
Wow.
crawling
Right.
around the facility for good reasons, right? From a security standpoint, our employees are trying to figure out what the heck is going on. But it was really well planned. Our teams did a great job just kind of showcasing the work we do. And I will say, RFK in particular he was just he was very curious
Yeah.
throughout the whole thing, and
Yeah.
I didn't necessarily know that about him. When he came in, we had our meals kind of lined up and our chef and,
Mm.
and registered dietitians, and he just like did a beeline for the meals and started asking questions and wanting to know more. And just throughout it, he was engaged. I think he just wanted to learn and see how
Yeah.
this could apply elsewhere. His team is keeping him on a very tight schedule, and so
Mm.
um, at times we had to move him along because he's just kind of, on the tour. He's kind of just sitting there and like just watching everything happen. So it was cool. And then he was really gracious also with the employees, where again he's on a tight timeline, but he stayed for probably half an hour at the end and just took selfies with probably 50 or 60 employees, and
Awesome.
that made their day. So that was all really cool. And then I think when he posted about it, that was really neat. But then, as you mentioned, it was then coupled with just some of the more critical and some of the scrutiny that we received as well. And for us, it was, we kind of knew that putting ourselves out there, we would attract more scrutiny. And initially, it was frustrating with just kind of how some of the comments were characterized. But I will say, getting back to your first point, Jackie, is in the end, I think it's a positive thing, first of all, that we're talking about this, right? That there
Yes.
needs to be more of a conversation around just taking a harder look, right, at what we're eating and is that doing service to our health. And I think a lot of that also for us made us realize there's such an opportunity for
Mhm.
education and just to have more dialogue around really how do we bridge the needs out there for better nutrition and the rise of chronic disease with like practical solutions that meet people where they are, really help address those needs. It was a little bit of a roller coaster.
I'm really amazed by the level of curiosity, even at the highest level in my small interactions with this administration. I think that's the perfect word. The level of curiosity is really there. And it's why I think there's so many people out there, especially those who are looking to make political points, which is completely understandable. But in my line of work, this is not actually supposed to be political. Nutrition is not supposed to be partisan at the very least. It might be political as in it's affected by policy, but it's not actually supposed to be partisan. It is supposed to be something that all of us can really galvanize around. And I to your point, I think food as medicine is exactly that. And it's why it's something that should be so unifying. So that's why I want to ask you this question, because this is the unfair part of things. I have my own theory, but I'll share that with you after the fact. I want to hear from you. The main headline that I saw after this visit was RFK visits facility providing medically tailored meals to individuals across America. Only problem is they're ultra processed. What do you say to this? Because this drives me insane. I'll just zip it and let you talk.
I think a couple things come to mind for us that we would just love to expand the dialogue around is, one is it's interesting right now there is no universal definition for ultra processed, right? Everyone's kind of putting their own perception on it, and then it gets cast as this blanket statement. And so I
Chris, I
think
have to interrupt you for a second because
yeah,
I just want to call out that right before we recorded, and I meant to actually send this to you, and it completely slipped my mind. I don't know if you saw that today the USDA and HHS issued that joint statement that's like
yeah,
a request for information about what the definition of ultra processed actually should be. So to your point about curiosity, it's definitely there. I mean, this
yeah.
administration is looking for, at least these two agencies are certainly looking for more feedback about what the definition of ultra processed should be so that we can get something clearly out there and perhaps incorporated into the dietary guidelines. Because unfortunately, the research is lacking about what a standardized tool should look like, even though a number of us have different ideas about what that might mean. So carry on. I'm sorry.
Yeah, no, definitely. And it's so timely, and I think that would be a good step forward is like, hey, let's
Yeah.
all kind of agree on what the definition is. And one thing that I think maybe a lot of people aren't aware of is processing itself, food processing itself is not in itself a bad thing, right? There's a lot of use cases for like, freezing food or chopping or pasteurizing. A lot of them have a lot of benefits in terms of making food more accessible, extending some shelf life for people that don't have as ready access. And there's processed or highly processed foods that you and I and a lot of others would say like that's healthy food, whether it's multi-grain breads or certain Greek yogurts. And so again, moving away from the umbrella term and everything's bad if it's processed, I think there's more nuance there. I think the other thing that, at least that we see, is one of the reasons that the term ultra processed is under scrutiny is I think a lot of ultra processed foods that are commonly associated as being ultra processed are also, they're loaded with sodium and added sugar and saturated fat, right? And that is much of the reason why we should be consuming less of that. We're finding ways to, evolve that. Our meals are designed with registered dietitians. We kind of start with the nutritional guidelines, right? And so we're looking at the dietary guidelines for Americans, the USD, FDA, the American Heart Association, to ensure that our meals are nutritionally balanced and that they are very limited in terms of some of those elements like sodium and added sugars and saturated fats, that I think there is broader consensus around the American diet today is too rich with those, and that they are, contributors to chronic disease. And so that's something that we need to continue to do with visibility around that. The other thing I would say is we try to be very thoughtful around what are the ingredients in our meals and making sure that they do serve a purpose, right? Whether it's, for taste, for nutritional value, and in some cases, it really is, food safety, because we have to deliver meals that are ready to eat to some of the most remote locations, ensuring that those meals stay fresh, aren't spoiling, that they're free of microbial growth, to keep those clients safe. That goes into the recipe and the design of those meals. We kind of have to look at all of those things in conjunction as we think about what, sort of the right direction for healthier nutrition.
This is probably what frustrates me the most about RFK and some of what he said about nutrition related topics. Why I feel so grateful to hear about his genuine curiosity and generosity of time and effort to spend with your team. The impression that I got from looking at the media coverage after the fact is that people were hopping on this issue for no reason that actually has to do with mom's meals or the quality of the food, but because of so much of what he said about things like seed oils or artificial additives or preservatives, right? And yet, to your point, there's absolutely no way to do what you're doing without ensuring that food safety comes first, and that nutritional quality and composition is also first and foremost, so that these two things are both equally the number one priority, along with taste, of course, because to your point, it's not nutrition if you don't eat it. A lot of the coverage was really about, I don't know if it's the right word, but it sort of feels like the schadenfreude of watching Kennedy step in it. Like as if he was, it was sort of the gotcha moment of the media to be able to be like, look at you, you said you don't like ultra processed, and this is technically under a NOVA classification, ultra processed. But at the same time, I think everything that you just said and everything that we know about this shows us why nuance is so important and why actually processing is so necessary. We can't just throw the baby out with the bathwater. We can want people to eat more real whole foods, but we have to be careful that we are not totally shunning the processing component, because it is necessary for making food safe, affordable, and accessible.
I could not agree more. And you're so right about the nuance. And that's, sometimes the challenge, right, is we live in a society, right, where it is like headlines and sound bites, and it's hard to capture that nuance in there. But at the same time, we need to be able to either educate or communicate things in a way that people understand, right, and can get behind. One of the things I really applaud you for in a lot of your podcasts is kind of coming back to the science, because there does seem to be a lot of, it's dizzying for consumers in terms of what is healthy, and you have a lot of trends or fads, and it's just hard to know. And so that's one thing that we're trying hard to do is really trying to keep up with the latest, really evidence-based science. And what is it telling us what types of ingredients truly are good and functional and healthy, and which really are potentially at risk of not being healthy? We look to national standards and state standards, and we go above and beyond that in terms of making sure that synthetic food dyes are out of the meals. That's not the end all be all, but it's things like that. High fructose corn syrup we had in a few meals a couple years ago. We made an intentional effort to move that out. It's a continuous process as we learn more. So I think it's kind of a continuous improvement process of making sure that again, the ingredients serve a valuable purpose, and where there's science that indicates we're trying to, move in that direction.
Anything that you remove from food is only going to be as good as what it's replaced with, and
Right.
particularly only as good for you as what it's replaced with. So I think about something like the synthetic dyes, particularly from the standpoint of food companies that really need those food dyes in order to make their products, like Mars and M&Ms, for example. No one is sitting down to eat a bag of M&Ms thinking this is a salad. Like, this is the healthiest thing I could be eating. That's the most critical point. Does it matter that you're having small amounts of synthetic food dyes? Because if you switch them out for something that is natural but hasn't been studied as much as some of the synthetic versions, then you may be doing something accidental to your product that actually makes it more harmful for certain populations or for certain people who may have just thought, I'm not sitting down to eat a salad. I'm just having a bag of M&Ms while I watch this movie. And I'm certainly not advocating for candy, but it's just to the point that all foods really do ultimately fit and can fit in a balanced eating pattern. But there are certain foods that are never going to be nutritious. Coca-Cola for one, candy for another. It doesn't quite matter what the commoditized food product is, or the synthetic or naturally occurring food dye is that's in there. It really matters that we are limiting them, and that ultimately their abundance and our access to these products within our food supply is just limited in some way, and we have other options available to us. Because I actually don't even want to say limited, because we need other things to be available in order to make that choice easily and seamlessly.
Yes. And a lot of things you said, like moderation and balance is, I think, often gets lost. It's, so often it's like black or white, right? You got to eliminate it all together, and this is bad, and this moderation is critical.
From an industry standpoint, who else in the food as medicine space are you looking to for inspiration?
20 years ago, when Mom's Meals was talking about food as medicine, it was like a lone voice shouting into the wind, and now we see some great academic research institutions publishing and generating more data and evidence around, good food as medicine protocols like Tufts University. There's great philanthropic organizations like the Rockefeller Foundation that's doing great work, just raising awareness around this. Help a lot of folks in the healthcare system. One of the areas that we see a lot of great innovation is a lot of states. It's because you think about states they have large, very sick populations they have to manage under Medicaid, which is often the number one and number two largest budget item. And we're seeing a lot of great innovation across the spectrum. So California's done some great work really getting nutritious food and nutrition counseling out to so many different underserved populations that had never had access, even folks that are housing insecure, certainly a lot of the chronic disease populations, folks that have recently been incarcerated and are transitioning, and they're seeing great results there, to some of the red states like Texas and Oklahoma that have passed food as medicine bills and said, even despite fiscal pressures, this is an area that we want to invest to help make our populations healthier. So I think that's some of the most inspiring work. One of the areas that we're doing more work in today is New Mexico. Having visited there now a number of times, they have such rich cultural heritage, but they have some of the highest levels of food insecurity, some of the highest rates of diabetes, and some of the most remote just food deserts. So there's counties there where 50 miles to the nearest grocery store, right? And the only access to food is really corner stores or dollar stores and fast food restaurants. To address this issue at scale, we have to think about some of those underserved populations, the barriers they face, and also think about what are they eating today? What are their options today? And how do we do better than that? Forget about ideology. We let perfect be the enemy of just better.
What do you think needs to change both from an industry standpoint and from a policy standpoint in order to make this a little bit easier for you and for your colleagues in the food as medicine space?
It really is going to take collaboration, certainly policy advancements to recognize food more as medicine and as an integral part of our healthcare system with more coverage pathways for those that need it. It's just a lot of education and collaboration with state and policy leaders. There's definitely an industry piece where eventually our healthcare providers, doctors, healthcare systems who are seeing patients at the point of care and are in a position to be able to direct them to nutrition resources or registered dietitian, I think is ultimately where we want to get to. Payers, that health insurance companies, there's been some good progress, but a lot a lot longer to go in terms of broader coverage for food as medicine in fiscally responsible ways. And then community-based organizations, there's, wonderful nonprofit organizations, food pantries, local meals organizations that we need to also weave into the conversation as well to ensure that especially some of the highest risk individuals have community-based resources that can support them on an ongoing basis.
Are there any resources that on a day-to-day, besides money, because of course that's the ultimate resource, right? But on a day-to-day, are there certain things, let's say technological innovation or AI, or are there certain tools that you think, God, this would be so much easier if we just had X?
I think there's huge potential for technology. I don't think we'll ever want to replace kind of the human contact, especially with health and nutrition coaching with a registered dietitian. But we face demands all the time from our clients who just have questions around nutrition or what should they be shopping for or how to prepare meals. And sometimes you're limited by just kind of the teams that you have or the capacity, trying to leverage AI to extend the reach of registered dietitians, using technology to meet people where they are so that they don't have to visit a grocery store or pick up the phone, and just make that access to healthy nutrition just easier. That's an area that we're investing in pretty heavily.
I have to tell you that when I worked for a magazine, so I was at Good Housekeeping for years, and we would get a reader who would write in and they have a vast culinary background, or you could be getting someone writing in who has absolutely no idea where the stove is and how to turn it on. Do you ever get some of these questions where you're like, yes, this is where the stove is.
Yes.
And this is how you just turn the knob to the right.
100%. And it's all over the spectrum, to your point. And you have people who are like real foodies, right? And will ask really thoughtful, provocative questions around different cuisines. Because of the populations we serve, you're homebound, again, many are disabled. A lot of times Mom's Meals is their social connection. And so it's why the team for us is so important. Who we choose to bring on the team, it's very much folks that want to serve a mission, that are very service oriented, that have empathy and patience. But that's one area that we don't want to get too technological, because just that voice on the other line is so important. And it's also a great engagement point. So for a lot of the people we serve, they're kind of disconnected from the healthcare system. It's also a great opportunity to just check in on how they're doing. Are there risks that we're seeing so that we can connect them back into the healthcare system, even outside of nutrition?
Just tell me a little bit more about that, because that's really an incredible point of difference. If you hear something that comes up as concerning to you from a patient, what is a red flag that would have you elevate whatever the concern is back to their provider?
Because we're serving a lot of state Medicaid programs and Medicare, we are kind of mandatory reporters, which means that our teams, whether it's our customer care teams, our drivers who are seeing individuals face to face, are trained to be able to kind of look out for certain risk signals, in some case ask the right questions, and if there are yellow flags or red flags, that we are quickly directing them to their case manager or someone that can help. It's an important function that we serve. And there's our drivers in particular. They get to see these individuals. A lot of times our clients build a relationship with the drivers. They look forward to the deliveries. We've had some incredible stories where we had one driver who has now saved 2 people from burning houses, literally in the course of 2 years.
Wow.
And they weren't even clients. He was on his route delivering to our clients, and he saw in the background people were screaming and the house was on fire and everyone's just kind of waving their hands. He literally went into the house. There was a man on the couch who was disabled, and he picked him up and he carried him to safety. It's that human connection. It's also the importance of the kind of team members that you hire and nurture and what drives them. But he did that 2 times in 2 years, and it's like, oh my God.
That's amazing. The fact that they're not even clients, it speaks to the quality of people that come to join your team.
We've got an amazing team.
What is next for Mom's Meals? What's the future looking like the next year, 5 years, 10 years? What are you hoping for, and what are some of your goals that you're able to share with us now?
The biggest focus for us is really expanding access. Our mission is improving life through better nutrition at home. So it is why we've been a very low profile company, family run, Midwest, always our heads down. This is where it really is working with policy leaders and states to really expand coverage, right, for people that need it. One of the areas I think of real innovation for us is just demonstrating evidence and data for different patient populations. It's not just the homebound elderly and disabled individuals. It's not just the chronically ill. We're doing some amazing work in maternal health, especially with high-risk pregnant moms who have gestational diabetes or other risk factors, where we're finding incredible evidence that good nutrition is having a significant impact on maternal health outcomes in a country where we have some of the worst maternal health outcomes of any developed country. We did a program in Michigan with very high-risk pregnant moms there, and just 10 months of meals that are nutritious, tailored to them, help reduce NICU stays by over 50% versus, a control group, reducing the number of cases of low birth weight babies, and just setting up, mom and baby for a healthier path through nutrition. So that's super exciting. It's like, how do we develop more data and evidence around that, and then work in partnership with states, health plans, policy leaders, to double down on that and expand access to more people who could use it.
Amazing. Chris, where can people find out more info about Mom's Meals and get connected to you guys?
Our website, www.momsmeals.com, would be a great place to start.
Thank you so much for being here today. I could not appreciate this conversation more. I really feel like you guys are doing some incredible work, and I wish you the best. I just keep on keeping on. You're really off to an incredible start only 26 years later.
Thanks so much. I really enjoyed the conversation. Thanks so much for having me on.
Appreciate it. Thanks so much for listening to The Business of Wellness. I'm your host and executive producer, Jaclyn London. Remember that advice provided on this podcast is based on my application of research and practice as a registered dietitian and should not replace medical advice provided by your physician. If you like what you're listening to, please follow the show, leave a 5-star rating, and share something you love from today's episode by leaving a review. This podcast only grows with your support. So if you enjoyed this episode, share it far and wide. It may be the one thing someone needs to hear to start building that roadmap today to secure a healthier, happier future. That's it for now. So until next time, cheers.